Hi. So you might be feeling dissociated in therapy. Maybe it's the first day, maybe you've been working with someone for a year, but for some reason you're feeling stuck or distracted or dissociated. And there's probably a good reason. There might be a manager part that's preventing you from going deeper, or you might be having a freeze response. But for whatever reason, it's not a problem. Dr. David Grant has a great saying that it's not a problem unless you make it a problem. And in this case, it's really important to have the curiosity about what's happening for you. Because in a lot of modalities, other than brain spotting and some of the other body centered forms, they might feel like it is a problem and want to get some activation going or try a tool to get you to come out of that state. But you see, if you trust the brain, it'll then move forward with information. If you trust the body, if you trust whatever's happening, even if it is, a dissociation, then the body relaxes. It's a very compassionate way of working because you're not moving against what is organically happening. These things are very organic. These protections are so deep in the subcortex, happening organically. So the way we heal is with dual attunement. You want to have somebody who's really present to you. This is a very mindful process as we go back into the subcortex and we access those very old programs and we bring them forward to update them. That can feel really dangerous to the system. But slowly, as we bring the child forward to our adult, they can integrate and she can heal and reprocess. So we don't need to figure it out. We don't need to fix anything as therapists and as clients. Well, as clients, you know where you're going in your deep brain. It's not the mind. But the mind tends to be more neocortical, more in talk therapy. We're creating stories. And talk therapy can be great because you can analyze and put things together, but ultimately it doesn't heal the original wounds. And so that's why, we don't need to fix anything or figure it out. Dr. David Grant has another saying, and it goes, "It is what it is long before it is what it means." So, we don't necessarily know why we're sad, why we're dissociated, why we're anything, because so much of it is connected to old programming, to incidents that happened so far back in the past. So that's why I like these body-centered forms, because they allow these things to move forward, these trauma capsules behind a dissociative barrier to come out and be reprocessed. It's very neurobiological, this brain spotting process. The neurobiology of two people in the room, the neurobiology of the client who knows its brain, that knows exactly where, what it's bringing forward and where it needs to go. So as in brain spotting, we're taught to really sit with uncertainty. Instead of using our tools and techniques and feeling smart, feeling like we know what's happening because we've seen it before, we don't know. Everyone's a unique individual with a very unique past and history. And so we want to allow in the space of uncertainty, these things to come forward and be revealed, these sacred things to come be revealed. And we have a great deal of compassion for this process because it is not easy, especially doing the subcortical work. For some reason, the neocortical work, we can stay a little bit distant from the intimacy of the pain. It takes a tremendous amount of courage to do this deeper work that happens in brain spotting, that happens in these body-centered forms. So I hope you will develop more of a curiosity and compassion for these times that you feel dissociated, distracted, or stuck, even in your own life. So if you want to know more about brain spotting, you can go to brainspotting.com or my website, jenniferdelaney.com. There's a lot of information on there. Take good care.